Good afternoon, and all the viewers who have joined us. My name is Tulani Chefuta, the co-convener of the campaign. Essentially, this is a platform where we acknowledged that no one has planned for the disaster that has befallen our society, that of COVID-19. And so, as structures of civil society, we positioned ourselves not to ask what government will be doing in response to this virus, but we positioned ourselves as part of the solution in addressing it. And so we went out of our comfort zones and called upon all structures that are organized within civil society to come on a common ground where we combine our ideas, where we combine our efforts, where we combine our resources in making sure that we put one strong foot forward in the name of civil society as part of the efforts in the national fight against COVID-19. And so we have in our network organizations that are under the community constituency of NEDLEC, which will be various apex organizations representing youth, women, the disabled, the civics, and various other networks of campaigns, the cooperatives, and so on. We went on to have, again, a wide network of civil society organizations that are organized under the SANEC Civil Society Forum, which has a variety of other apex bodies and networks within civil society itself, which includes other gender-based organizations, men's sector, LGBTQI, the traditional leaders, many sectors. And so we have also a network of NPOs that is within the fold, where the various networks are organized under an umbrella apex, and they are also in the fold. We also have organizations that represent the informal sector. And so we are a very wide and broad network which has a national footprint across the country. In this network, we have defined ourselves a specific role to play in the fight against coronavirus. One of the things that we have positioned ourselves to do is that we will continue to do advocacy, which some of the colleagues will articulate on. Those issues of advocacy will continue to be raised at NEDLEC, at SANEC, and many other platforms. As we are an organized formation now, we will pick up some of the issues directly with the National Command Council. And we will also pay attention to what we have defined as community-based measures as part of the response against coronavirus. What will be involved in some of those community-based measures will entail a direct mobilization of communities to be part of the response. We are basically leveraging the social capital of communities to be the first line of defense in the fight against coronavirus. We will go on and do public education awareness. We will monitor compliance with the lockdown regulations and beyond. We will be in the front line of distributing supplies that are needed by communities. We will identify the needs that communities have and escalate those to the relevant authorities. We will also serve as a point of referral where communities and individuals and households can continue to get points of access to services. Thank you very much.
Thank you so much. Look, I think Tulani has raised the importance of diversity among civil society, community groups, that exist. And one of the key factors that we want to contribute as civil society, it's really the contribution around tracking, contact tracing. It is very important because it's not just about tracking those who are potentially exposed to the virus, but it's also about ensuring that we can pass on the correct messages around COVID, but also around multi-viruses and diseases that we're dealing with in this case. SANEC works around HIV, TB, and STI. And when we speak about a respiratory disease like COVID, it also is linked or interlinked to tuberculosis. So part of the contact tracing is to really deal with the multi-phased issues, but it's also really to address the health-seeking behavior in our own communities. What we want to link in making sure that there's access to services, there's access to correct treatments. There's also access to securing services, not only limiting it just to those in private medical aids, because we've called anyhow the national health insurance to be accessible, and this is the time also to test whether we are able to ensure services for all without any discrimination factors. One of the other key issues, the healthcare workers, who are key in the response, in their diversity, whether one is a nurse, a doctor, a healthcare worker in the community in helping in tracking. And part of it is to ensure that the healthcare workers themselves are not exposed. They have precautionary measures in place as government has put, but they also have protective measures that are required. The second issue is the issue around water and sanitation. It has been raised not now, but also in the past around access to water and sanitation. We know we come from communities, informal settlements, rural areas, townships, where a lot have been exposed to limited access to services like water and sanitation. I mean, here we are in Pretoria, where we've seen experiences of Hammanskraal, where there was no water for a very long time, and the Tshwane municipality has limited that access. We know what is happening in Lusikisiki. We know what is happening in Phokeng in Northwest. But these are some of the advocacy issues that we are raising, but we are also making sure that we are following up, we're getting in touch with the rightful municipalities, departments, to make sure that they can link up to the issues. The last biggest issue, which is the really disheartening issues that we are dealing with, is the issue of income relief. Now, this is not only just affecting a society of entrepreneurs. It's also affecting any other ordinary member of society. We're dealing with high level of unemployment. We're dealing with quite a lot of social dynamics that really finds itself spilling over to the health issues. Now, how do we ensure that this does not challenge those in the economic power of business, but also those in the economic power of ordinary lives, whether one is a teacher, whether one is a informal trader, whether one is a cleaner, and so forth. So that relief is needed, even for those in the NGO. NGOs operate in funding. Without funding, NGOs are unable to operate. Of course, it's a civil responsibility that we all have done in the last decades in doing the work. But we are quite sure and certain that if civil society plays its role, the support to civil society, community groups, and these are community interventions that are needed anyhow, with the sectors, with NGOs, with networks, we will definitely fight the cause itself. And hence we are saying that with the campaign, I am responsible, you are responsible, and together we fight COVID.
Thank you, Nelly. What is happening here is the coming together of various people with various expertise, various people who have agency, leaders of various networks that have rallied behind a strategy that we have developed. That strategy is basically premised on 4 areas. One is on social mobilization, being in communities at a household level in the 52 districts and ensuring that the issues people understand, people comply, because we want to go back to normality. And the only way we can get back to normality is to ensure that we comply with the requirements that have been put on, in place. They are making our lives, they are disrupting our lives as we have known them. But the only way for us to deal with them is to ensure that we are engaged citizens. So social mobilization is a key component of what we're doing. But we also have media and communications. This platform and many others, we want people wherever they are to be in touch with us so that the issues that affect them at a local level can be addressed by people that have been assigned to provide solutions. But also it is constantly making sure that people, are aware. We remind South Africans so that they act in concert with what we need to do. The third area of what we are planning here, which is being done in communities, it's also around contact tracing and screening. There are people that are knocking in the homes, but people must understand why somebody's going to come into their houses and then knock and then ensure that we are all safe. Those that are infected, they receive help, and help needs to be provided as early as we can. But primarily, it is about advocacy, ensuring that the regulations that are in place to ensure that the disruption that COVID has brought to us, we all do things that ensures that no one is worse off in terms of what we are dealing with. So it's many South Africans of different ages who are ensuring that the 30 people that are here who are running the NEF Center, we're linking with about 520 other leaders in our provinces. We're linking with thousands others that are in the districts, and it's about ensuring that work that government is leading is supported by us as members of society, because it is when we comply at an individual level that we are going to stop the spread of this particular pandemic that all of us were, we didn't look forward to it being there. But what is then the call to action? It is for South Africans to comply. It is for South Africans to get in touch with us. There are people that are heading these various components. When you have an issue, we have a website, communityconstituency.org.za. In that, if you are an NGO, you are providing services, we're inviting you, tell us where you are, so that as we deepen the activities, the actions that needs to happen on the ground, we have all South Africans who have raised their hands and they say they want to lend a hand. But we are lending a hand to us, because if it's not us who are supporting that which we want to stop, then it's going to be a challenge for the nation as a whole. So we want South Africans to comply. We want South Africans to raise their hands and be part and parcel of the work that is being done.